Hello and hi. Today we are going to learn about phenylketonuria, or also called PKU. This is our group mate. Without any further ado, let's begin. First of all, what is phenylketonuria or PKU? PKU is a genetic condition where the body cannot break down phenylalanine, an amino acid found in many foods. This happens because people with PKU do not have enough of an enzyme called phenylalanine hydroxylase or PAH enzyme, which is needed to process phenylalanine properly. Now, let's talk about the genetics behind PKU. PKU is inherited from parents and follows something called an autosomal recessive pattern. This means a child needs to inherit the faulty gene from both parents to have PKU. The gene responsible for this is called the PAH gene, which gives instruction for making the PAH enzyme. If this gene is mutated, the enzyme does not work as it should. PKU is primarily caused by a deficiency in the PAH enzyme. This enzyme plays a crucial role in breaking down an amino acid called phenylalanine. When this enzyme is absent or doesn't function properly, phenylalanine accumulates in the blood. Normally, PAH converts phenylalanine into another amino acid called tyrosine. However, in individuals with PKU, this conversion process is impaired, leading to the build-up of phenylalanine. Next, let's discuss on pathophysiology of PKU. Understanding these symptoms is crucial for early detection and intervention. Let's begin with intellectual disability. Infants with PKU typically appear normal at birth. However, by the age of 3 to 6 months, signs of cognitive impairment may start to emerge. If left untreated, the average IQ of these children can drop below 50, leading to severe intellectual disability. Next, we have neurological issues. As phenylalanine levels rise in the body, various neurological symptoms can develop. This includes seizures, tremors, and abnormal muscle movements, all resulting from the toxic effect of elevated phenylalanine on brain function. Moving on to behavioral problems, children with untreated PKU may experience hyperactivity, aggression, and self-injurious behaviors. These issues are not just limited to childhood. They can persist into adulthood if proper management is not implemented. Lastly, let's discuss physical symptoms. Individuals with PKU often exhibit lighter skin, hair, and eye color compared to their peers. This change is due to impaired melanin production caused by high levels of phenylalanine in the body. Now, let's look at some additional symptoms associated with PKU. One notable symptom is a distinctive odor. Many individuals with PKU have a musty or muzzy odor in their urine, breath, or skin. This odor arises from the accumulation of phenylacetic acid, a byproduct of phenylalanine metabolism. Next are dermatological issues. Affected individuals often present with eczema-like rashes that can be exacerbated by high levels of phenylalanine. These skin conditions can be uncomfortable and require careful management. Another significant concern is growth delays. Children with untreated PKU may experience stunted growth and microcephaly, which are indicators of developmental delays and nutritional deficiencies stemming from dietary restrictions. Finally, we must consider the risk of psychiatric disorders. Long-term untreated PKU can lead to increased rates of depression and anxiety disorders in adulthood. This underscores the importance of ongoing management and support for individuals with PKU throughout their lives. There are few stages of PKU. The first stage is newborn stage. In the newborn stage, babies with PKU typically appear normal at birth. However, routine screening conducted shortly after delivery can detect elevated levels of phenylalanine in their blood. This early identification is vital for initiating treatment before any symptoms manifest. As the child enters the early developmental stage, usually between 3 to 6 months of age, initial signs of developmental delay may become apparent. Parents might notice a loss of interest in their surroundings, which can be concerning and indicative of underlying issues. During fourth stage, neurological symptoms emerge. Children may experience seizures, tremors, and abnormal movements. Behavioral issues such as hyperactivity and aggression can also arise, impacting their interaction and social development. As individuals with PKU grow older, they may face persistent cognitive and behavioral challenges into adulthood. there is an increased risk of psychiatric disorders, making lifelong management essential to mitigate these effects. In summary, this overview highlights the progression of PKU from a seemingly normal newborn to potential long-term challenges if left untreated. Next, we will dive into how PKU is diagnosed. PKU is diagnosed through newborn screening, in which a blood test to measure the level of phenylalanine. A small sample of blood taken from the baby's heel. If the result is positive, which is the level of phenylalanine is high, further testing is often conducted. This testing includes a second blood test, urine test, and genetic tests. Though genetic tests are conducted often to identify the specific gene mutation causing this disease. For parents who already have a child with PKU, the risk of having another child with the same condition is higher. Nutritional assessment for PKU involve 4 key components. Anthropometric assessment measures height and weight, which are crucial for BMI calculation and monitoring growth, and measures head circumference, as PKU can cause growth retardation and restrict head growth. Dietary assessment uses tools like 24 hours diet recalls, food frequency questionnaires, and food diaries to evaluate nutritional intake, monitor phenylalanine levels, and address malnutrition due to dietary restriction. Biochemical assessment focuses on maintaining safe blood phenylalanine levels to prevent irreversible intellectual disability and monitoring deficiencies in micronutrients like vitamin B12, iron, zinc, and folate. Lastly, clinical assessment includes neurological checks for brain damage from phenylalanine accumulation and physical checks for symptoms like skin rashes, lighter pigmentation in skin, hair and eyes, and also stunted growth. We will now explain about the management of PKU. There are 2 types of management that we will be discussing in this video, which are medical management and nutrition. There are 3 points in medical management nutrition of PKU, which are phenylalanine restricted diet, micronutrient and caloric balance, and age-specific consideration. Phenylalanine restricted diet is a diet that limits or avoids food that contain phenylalanine, which is a type of amino acids that can be found in protein-rich foods. Basically, we need to do protein management. Firstly, we need to avoid high-protein foods such as meat, poultry, fish, eggs, dairy products, and nuts. Next, we need to take low-protein diets such as white bread and pasta that are made from refined flour. Lastly, medical protein substitute also can be administered because it was specially formulated with protein without phenylalanine. Next is age-specific consideration. For infants, we use special formula for PKU, while mothers breastfeed their babies. Typical phenylalanine content in breast milk is 14 to 20 mg per 100 ml. How do we calculate the amount of phenylalanine that was allowed? 30 to 50 mg phenylalanine was multiplied by baby body weight in kgs. In young children, only 200 to 400 mg phenylalanine was allowed per day. Daily blood phenylalanine level should be maintained between 120 to 360 micromole per liter. In adolescent, tolerance of phenylalanine should typically range from 300 to 1,200 mg per day. Blood phenylalanine level should be maintained around 120 to 360 micromole per liter. In adult, phenylalanine allowance per day range varies and typically ranging from 300 to 1,500 mg per day. So, blood phenylalanine level should be remain between 120 to 609 micromole per liter. For calorie intake, infant and children should be taken at 90 to 120 kilocalorie per kg per day. Meanwhile, for adolescent is 40 to 60 kilocalorie per kg per day, and for adults it's 25 to 35 kilocalorie per kg per day. For micronutrient intake, vitamin D is recommended at 1,000 to 1,300 mg per day, and calcium is at 600 to 800 mg per day. It is essentially for bone health. For iron, it is recommended to take 10 to 15 mg per day. For your information, iron deficiency is common in PKU patients because they need to limit iron foods such as meat and eggs. Next is zinc. It is recommended to take only 5 to 10 mg per day. Intake of zinc is crucial for growth and immune functions. Vitamin B12 needs only 2.4 microgram per day and supposedly higher in pregnancy. For omega-3 fatty acids, it is recommended 200 mg per day of DHA and EPA. Omega-3 fatty acids are crucial for cognitive function. Lastly, folate. Folate is used to support cell growth and DNA synthesis. It is recommended to take folate for 300 and 400 microgram per day. Let us continue with lifestyle management. First, consult a registered dietitian. A qualified dietitian can help you create a designed food plan that is nutritionally balanced and low in phenylalanine. Aside from that, people with PKU should learn to read food labels attentively. It is essential to carefully read labels and pick low phenylalanine option, as many processed foods include hidden source of phenylalanine. Also, try to cook at home as much as possible. This gives you more control over the ingredients in the meals you prepare. Last but not least, pack snacks and meals for the journey. When traveling, it is best to prepare snacks and meals ahead of time. This will help you avoid eating foods high in phenylalanine. Moving on to the last part, which is a diet suggestion for patients with PKU. They are recommended to eat low phenylalanine foods such as fruits, vegetables, and low protein foods. They are also recommended to take protein substitutes that are usually available at local pharmacies. Artificial protein substitutes are derived from phenylalanine-free amino acid supplement. On the other hand, patients with PKU are advised not to eat food which are high in protein such as meat, fish, poultry, legumes, nuts, and dairy products. Artificial sweeteners are also included in the what not to eat list, as products containing artificial sweeteners like aspartame will be broken down into phenylalanine. For the last part, there are 4 menus that we can suggest to these patients, which are PKU Caesar salad, PKU fruit salsa with chip, PKU cranberry scones, and PKU acai bowl. The ingredients used are substitute with low protein ones, making them low in protein but high in fiber and flavors with a variety of textures. These are our reference, and those are all from us today. Thank you for lending us your ears. Bye!